Well, hey, everybody, this is Robert, and welcome to Outbreak News Interviews. Now, the World Health Organization recently warned that a major chikungunya virus epidemic risk sweeping across the globe, and they're calling for urgent action to prevent it. Now, the call to action urges countries to scale up their laboratory diagnostics and surveillance, train staff, and strengthen healthcare systems as cases are appearing in popular travel destinations across Europe, Africa, and Southeast Asia. Well, joining me today to examine this topic is Ben Simone, MD, FFPH. Ben is the Global Medical Affairs Director for travel vaccines at Bavarian Nordic. Dr.
Great to
Simone,
be
how are you
here.
doing, sir?
Hi, I'm all right. How are you? Thanks for
I'm
having
well,
me.
thank you. Thanks for coming on the program. Um, let's go ahead and just start out with a little bit of an overview of what is chikungunya. If you could talk a little bit about the transmission, symptoms, including the long term, and treatment, if there's any.
Sure. So, first thing that you have to know about chikungunya is it's a viral disease and it's mosquito-borne. So, chikungunya is spread mostly by two types of mosquitoes called Aedes aegypti and Aedes albopictus. And these are the same mosquitoes that carry Zika or dengue. The main symptoms of chikungunya are very sudden, and they consist of fever, high fever often, severe joint pain. Often you have it in your hands, your wrists, ankles, your knees, and then you have muscle pain, headache, rash. In some cases, you can have swelling also of your joints. And normally, chikungunya lasts for 5 to 10 days approximately. And please keep in mind, 5-10 days is a long time to be in that kind of pain. Now, in about 40% of patients who get chikungunya, what happens is that this disease tends to chronicize. So you can have chronic chikungunya disease that can last for months or even for years. And again, it's characterized mostly by these arthritic manifestations. So it's an involvement of the joints. And this has a big impact on quality of life, on the ability to work, on the ability to perform your daily tasks. And in some rare cases, chikungunya can also have severe manifestations. So it can involve the brain, nervous system, the heart, cardiovascular system, kidney, liver, the eyes. But normally, these severe manifestations are more common in people who are at the extremes of age, so very small babies or very old individuals, or it can be in people who have concomitant illnesses.
Mm-hmm.
So diabetes, hypertension, obesity, cardiovascular disease, these are all risk factors for severe chikungunya. But when you think about chronic chikungunya, the risk is kind of age related. So already at my age, early 40s, you already start to see an uptick in the risk of chronicization of chikungunya. And I think you asked me about treatment. And again,
Yeah,
I think this
it's
is.
it's a viral disease, but is there any treatment available for it?
Yeah, and you were asking about treatment, and I think it's a really important topic. There is no treatment for chikungunya today. So, of course, we can give pain medication to alleviate a little bit the discomfort, but there is no approved antiviral to treat chikungunya today. And that really places the importance on prevention, on awareness, and on timely reporting of chikungunya. The first line of defense against chikungunya is always all the mosquito bite prevention
Right.
measures. So using mosquito sprays religiously, making sure you can wear long sleeves. But I was talking about awareness, and this is something that is not really fully there. For example, did you know that chikungunya is spread by mosquitoes that bite during the day, not at night? And that means that, for example, bed nets, they don't really do anything for chikungunya. They work for malaria, but not chikungunya. So it's really critical to know what chikungunya is and to understand also when you potentially have a chikungunya case in front of you. And of course, there's vaccines as well. This can be an additional tool to help prevent chikungunya, to reduce the risk of transmission in patients for whom it is indicated.
Yeah, and we'll dive into the vaccines a little bit later in the interview.
Sure.
Um, well, Dr. Simone, how common is it? Here's this strange name that's out there, and a lot of people have no clue what this thing is. So, how common is it? And geographically, where do we see it endemically?
That's an excellent question again, and chikungunya has been first identified in the 70s, but when we look back at older literature, outbreaks in the past that were described as dengue, they might actually have been chikungunya because they're really described as these outbreaks where long-term pain and joint pain was really a characterizing element. So it might as well be that chikungunya has been around for quite some time, even before we had the right diagnostic tools to be able to identify that. But now what we are seeing is a lot of changes on this planet. First of all, the warming of the planet in general, and what we are seeing is also is movement of people. We're seeing urbanization becoming more and more of a phenomenon. We also see a lot of international trade, and with trade, what happens is that larvae and eggs of mosquitoes travel all across the world. And all of these factors are effectively contributing to spread chikungunya to areas where it was not present before. So there is a paper from Nature that has been published just a few days ago, where they estimate that areas at risk of chikungunya cover some 5.6 billion of people on the planet. So that's 2/3 of the world population. And but in terms of where chikungunya is today, now if you go to the CDC website, you will see a list of countries where there is a recognized ongoing outbreak. We know 2025 has been characterized by a big outbreak in the Indian Ocean region. So a lot of countries facing the Indian Ocean are experiencing an outbreak. And this includes Kenya, Madagascar, Sri Lanka, Somalia, Mayotte, Reunion, the Mauritius Islands. So all these countries have been showing a very intense transmission at the moment, and they represent a big risk for people who travel to these areas. On top of that, we've seen transmission in Bolivia, and more recently in Guangdong, in the south of China. Guangdong was quite fascinating, actually. We went from a handful of cases to about 8,000 in a matter of a few weeks.
Right.
And that really speaks to the really violent and explosive nature of chikungunya outbreak. On top of that, there's also a list of countries on the CDC websites that are considered to be at risk for travelers. So where chikungunya has been identified in the past 5 years. And these include big countries like Brazil, like India, Pakistan, Mexico, Nigeria, Philippines. I can continue. So these are many countries that are very important hubs for travel, both for tourism, for humanitarian travel, for business. So it's really important to keep an eye on this website and make sure that you stay up to date also with the latest recommendations from the CDC.
The World Health Organization alludes to similarities to an an epidemic about 20 years ago. Dr. Simone, can you describe what happened in 2004, 2005?
Yes, so chikungunya is characterized, as I was saying, by these very violent outbreaks. And then in a very interconnected world, what you see is that the virus then travels with people from one place to another. So you see outbreaks popping up everywhere. Then you get to the point where there is some degree of immunity that is built in the population. And then after 10 years, 15 years, you will see another big wave of outbreaks. Now, we've seen a huge outbreak happening in 2004, 2005. One of the big hubs was the Caribbeans. Then we saw another wave of chikungunya, also transmission in 2014, 2015. And this is really what the WHO in their call to actions were referring to. In 2014, 2015, we had approximately 500,000 cases reported of chikungunya in different parts of the world, with a really significant burden on the population. Now, if you look at what is happening today, in 2024, we have reported some 400,000 cases of chikungunya and over 200 deaths. Most of these were reported in Brazil. And then in 2025, we are going in the same direction, and we might probably top up that number. We are already at some 250,000 reported cases and 90 deaths, but the year is still long. So, and I think to wrap it up, and if I can leave with a message, chikungunya is very severely underreported. And this is also something that was flagged by the WHO. Most countries that have chikungunya are low resource. They do not have the infrastructure to detect chikungunya, to diagnose it, and to report it, which means that what we are seeing is only the tip of the iceberg. We're seeing only what some countries report. But for example, just a couple of weeks ago, we found out there is an outbreak ongoing in the western part of Cuba. And we don't really have exact numbers of how many cases have been reported or what the epidemiology is looking like. And this is quite relevant if you think of the US, if you think of how close Cuba is to Florida.
Mm-hmm. Now, the WHO call to action is asking countries to scale up their lab diagnostics, surveillance, training, etc. Would you like to touch on any or all of these actions and how that would work?
So I think there's a few ways to approach this question. Of course, when you think about endemic countries for chikungunya, there is a lot that needs to happen and that is necessary in terms of ramping up a surveillance system, of enhancing diagnostic tools, of setting up a system to report, detect, and follow up all these interesting epidemiology of chikungunya. But if you look at what happens in the United States, and which I think might be also more directly relevant, there is no chikungunya in mainland US at the moment, but you still have a lot of travelers who return from endemic countries to the US with chikungunya. And sometimes these cases are not really diagnosed or identified properly. Because there is a low awareness of chikungunya in general, what might happen is that when a patient comes back with chikungunya, they're just sent home or on the suspicious of having a very nasty case of flu or something else. What is really important is that it should really be embedded in the triage for patients to ask travel history. And if the patient has been traveling to an at-risk country, is to immediately ask for a diagnostic test for chikungunya. And we said there is no treatment for chikungunya, but this is an extremely important measure because returning travelers are sort of a sentinel system. Mm-hmm. If there is no surveillance system in many countries in the world, the only tool you have to know that there is an outbreak is reports from returning travelers. And in that case, what happens is that once you identify a traveler with chikungunya, you can also inform travel health advisories from CDC, and that can help prevent more cases of chikungunya for people going to the same destination. So this is a really highly impactful public health measure that of really looking into cases of chikungunya diagnosing. Because if you're not really looking for it, you're not going to find chikungunya.
Yeah. Let me ask you a question.
Sure.
A lot of the World Health Organization is very concerned about this. I'm seeing it on different news programs here in the United States, especially with the way China was handling it and stuff like that. How concerned are you about this global spread? Are you at the same level of concern as, say, the World Health Organization?
That's again, I mean, chikungunya is a global health threat, and there is no way around it. Yeah. We are seeing chikungunya spreading to areas that we have never seen it before. Yeah. For example, Southern Europe. Over the past 15, 20 years, we see more and more small sporadic outbreaks in France, in Italy. So this is something that we will need to learn to live with. But the first thing is always to be aware of it and to understand what tools we have at our disposal to reduce this risk. So, of course, I'm concerned, but I think it's more important to really be prepared. Yeah. And I think really this is the call to action also from WHO is really, let's not just be worried, let's do something about it.
Right. Let's go ahead and switch gears to personal prevention. And you've already talked about mosquito bite prevention like that. But I want to go ahead, because you are with Bavarian Nordic. You recently received approval for a chikungunya vaccine, Vimkunya. Is that how you say it? Dr. Simone, you still there? Oh, looks like he froze on me. Hey, Dr. Simone, looks like you froze for a moment.
Yeah, sorry, I think we had a little glitch.
Okay, but anyway, I was going to ask, the vaccine that you guys got approval on recently is called Vimkunya.
Yep.
Okay, can you go ahead and talk about the vaccine and its uses?
Sure. So the FDA approved Vimkunya in February of 2025, and this is a vaccine that is approved for prevention of chikungunya in individuals aged 12 years and above. Now, the first interesting thing with Vimkunya is the technology that it uses. It's called VLP, or virus-like particles. So the vaccine contains these little particles that look like the virus. They are effectively a sort of a scaffold with fragment of viral proteins all around it. And they are recognized by the immune system as the virus. So they're able to trigger a very strong immune response. Now, the good thing is that you can think of them as an empty shell. So they do not contain DNA, RNA, which means that they are not able to replicate, cause disease, infect. And that makes this vaccine very suitable for or indicated for a very broad range of people. Now, we have approved vaccine with 2 phase 3 studies. The first one has been conducted in individuals, in adolescents and younger adults, 12 to 64 years of age. And the second trial has been conducted in an older adult population, 65 years plus. And what we've seen is we've met our primary and secondary endpoints. What we have seen is that the vaccine induces a very strong immune response in 97% of the younger individuals and in 86% of older individuals at 3 weeks. So it's a single shot of the vaccine, and at 3 weeks from vaccination, you have a very high response. Quite interestingly, also, what we've seen in younger individuals is that already 1 week after vaccination, half of the vaccinated people already had an immune response against it. And this is particularly useful if you think of people who are planning to travel and who show up at the last minute at the travel clinic. And in terms of safety, we've seen the vaccine is well tolerated. Vaccine-related adverse events were mild or moderate in nature, and they were quite short in terms of duration. So I think this vaccine is quite exciting.
Mhm.
As I was saying before, we have now 2 vaccines to help prevent chikungunya, to reduce the risk in travelers. And it's really interesting to see how these vaccines can be integrated also in travel health consultations. I was mentioning before, you have the mosquito bite avoidance, you mentioned them as well. When it comes to vaccines, it's not a kind of a either or situation. It's more part of a holistic assessment of what kind of measures can be used in a specific individuals to really minimize the risk of becoming infected. Excuse me.
Now, so can you explain to the audience how a vaccine that's mostly used for travelers, how does that fit into the World Health Organization's call to action?
Well, in a few months ago in April, we've also published that we entered into a partnership agreement with Biologically, which is an Indian company. So in the future, in the near future, we will be working at the tech transfer for the vaccine. And that is quite exciting news. It will allow us to essentially boost manufacturing production of the vaccine to really give access to the vaccine to a much broader audience, to a much broader group of people, also in low and middle income countries. For the moment, this vaccine is used and it has been approved in the European Union, UK, and in the United States. So this vaccine is effectively available mostly to people who are planning to travel to at-risk countries.
Okay, well, let me close with this. I want to give you an open floor. If you have any final thoughts about chikungunya, the World Health Organization's call to action, or the vaccine, and any other final thoughts?
Thank you. I think the most important thing that we discussed already is really the importance of testing for chikungunya returning travelers. That is the most important public health intervention that healthcare providers can do in the United States today. And then, if I can leave you with another final message, is really look for chikungunya. Keep also an eye on the CDC website, on the WHO website for which areas are at risk of chikungunya. Keep your information up to date and consider what are the best prevention methods to really address and minimize this risk. This, for sure, they will include mosquito bite avoidance, but they can also include vaccines as an additional tool that is in our arsenal today.
All right, very good. I want to thank you, Dr. Ben Simone, for sharing your thoughts on this topic. I really appreciate it, sir.
Absolute pleasure, and anytime.
Okay.